Happy Ta-Ta Tuesday. We're back at Delaney today. And last week, Dr. B mentioned density and the 2D and the 3D. So today we're actually going to look at 2D, 3D, the comparison, and let's just see what it is he's looking at and describe what's going on here.
Great, so I have 2D and 3D images here, and I want to show you the difference so you understand visually what we're talking about. Traditionally, the old 2D mammograms, this is all you had. You had these 4 views, the 2 craniocaudal and the 2 medial-lateral oblique views, and this is it. You'd have to look at it, see what's going on. This is the white area is what we call the dense tissue, and so we'd kind of look at it and look for things like masses, calcifications, distortions. This is a normal mammogram. Let me show you what a 3D looks like. So we have this view here. On 3D, we actually get to go through, and if you look at this area of dense tissue I was talking about before, I can actually go through it and it all disperses, it all spreads out. I can tell, is there anything hiding there? Is there any distortion in that tissue? And we can do that through the entire breast.
Amazing.
And so you just scroll in and out. So it's just like getting a CT scan of the breast tissue.
Incredible.
So it really is incredible. So things like architectural distortion, small masses in particular, really pop out on these studies.
One thing you mentioned was microcalcifications. What are they?
Well, microcalcifications are, so I can backtrack a little bit. So calcifications is it's the same calcium we have in our teeth, we have in our vitamins, we have in our bones. Very often, calcifications are deposited within the breasts. Almost always, it's benign. Right? It's not cancer. The list of things that cause calcifications in the breast is very, very long, and cancer is one of the things on the list. Now, a lot of times we can look at the mammograms and know right away, is it benign, is it malignant? Most of the time, right? For example, on this mammogram here, there is a big calcification right here. That's not a microcalcification, but the pattern that I'm seeing here with the lucent center and the circumscribed margins clearly tells me this is not cancer, this is a benign process. And most mammograms have some sort of benign calcifications on them. Every once in a while, the calcifications have a unique appearance to them. Usually we call it pleomorphic. Every one of them looks like a different piece, a different puzzle piece. Or linear branching, which implies that there's something going on in the ducts. When we see that pattern, it raises the red flags. We're very concerned that that may be an early sign of cancer, and often those patterns indicate that stage 0 disease, or ductal carcinoma in situ, DCIS that you've heard before. If we can catch that on a mammogram, you can cure that before it becomes invasive disease. And that's where sometimes it looks like that, we know and we're worried. Sometimes it's in between, it's kind of evolving. We're catching it early and we can't clearly say it's benign. We can't clearly say it's malignant. In those cases, we'll recommend a biopsy just to be sure. Because if we catch it early, again, curable.
Again, better safe than sorry.
Better safe than sorry.
All right. I'm going to go for the 3Ds from now on. No questions asked because I like being able to see all of that. Okay, you've learned about 2D, 3D today. We will be back next week with even more information about your mammograms. See you later.